We're now live if you'd like to make a start.
Right, thank you. Good morning. I'm Dorothy Davison, Executive Member for Adult Care and Public Health. This morning, we're bringing a report to the table with regards to respite care and charging for it. I'd like to pass over to Eric Scully, who is Director for Adult Care. Eric, would you like to present the report, please?
Certainly, Councillor. So good morning. My name is Eric Scully, as Dorothy said, and I'm the Director for Adult Social Care and Health Integration at Middlesbrough Council. The paper that we're talking about this morning and that we're requesting a decision on relates to residential respite care, which is where individuals pay for a loved one or family member, an individual with care needs, to spend a period of time within a residential setting to provide respite for the carer. Now, Middlesbrough Council historically has operated a charging policy for respite care, which has been on a flat rate per night basis. And what this means is it sort of gives a kind of predictable cost of respite care, but actually what we want to do, what we're proposing, is that we bring respite charging away from the flat rate cost to including it within the envelope of our financial assessment framework. So the law requires us within adult social care to do a financial assessment and to charge individuals for social care services. And that means that individuals who are better off relatively pay more of the cost or all of the cost of a social care service. And as individuals' resources are kind of reduced in the assessment, then so they pay less of that, down to the point where Middlesbrough Council supports the cost, pays the cost. Now, what we intend to do is, or what we're proposing to do, is in line with most other local authorities, all that I've been able to find, certainly in common with neighbouring authorities, and that is that our respite charging policy should be part of our financial assessment, just as it is for domiciliary care, for residential care, for day care. And that means that individuals at the moment who are better off, who in effect are being subsidised for the cost of residential care, they will be assessed on a kind of standardised flat rate. I don't think there's a great deal more that I want to say about that. I mean, it's a bit of a historical anomaly that Middlesbrough has carried on with the fixed rate for respite. I think that the norm is that individuals include it within the financial assessment. And I think in a time of financial challenge and austerity, I think the appropriate thing is for us to include all of our social care services within that standardised financial assessment framework, which is what we propose to do. Chair, I think that's probably all that I think I need to say on that at the moment, unless there are any questions or any points that anyone would like to put to me.
I have no questions, Eric, on this report at all. It's a very good report, and I'd like to thank whoever did this report for making such a good job of it. Oh, to you, Eric, thank you.
To our department.
Yes, thank you very much. I've considered this report and I do approve this report. Thank you.
Thank you.
Okay,